good afternoon, everyone, and thank you for joining us for our webinar today. We're happy to welcome not one, but two expert speakers, Nora Belcher and Tracy Spinner, who join us today and will provide telehealth-related updates coming out of the 2023 Texas legislative session. We have a couple introduction housekeeping slides, and then we'll go ahead and jump into the presentation. Right, so this educational activity is a project of the TexLa Telehealth Resource Center, a federally funded program with F. Murray Hall Rural and Community Health at TTU HSC, as well as Wellhead, Louisiana, with generous support from the Health Resources and Services Administration, or HRSA. And then these are just a couple of helpful tips for our webinar. Please make sure that everyone is muted. Please type any questions or comments you may have during the presentation into the chat box, and we'll have time at the end of the presentation for questions and discussion. And just to briefly introduce our speakers, we have with us today Nora Belcher, CEO of Texas eHealth Alliance, and Tracy Spinner, Senior Vice President of Education and Strategic Initiatives at Goodside Health. And with that, we'll hand it over to our experts.
Well, technically, good afternoon, everyone. I'm Nora Belcher, and I'm delighted to be here with my colleague, Tracy Spinner. Let me see if I can get my PowerPoint to cooperate. Okay, can everyone see the title screen? All right, let's get going. I'm going to give a little bit of my background, let Tracy introduce herself, and then we've divided this into sections, so we're both going to cover material that is near and dear to our hearts. I've been in this space a really long time, worked at Texas Medicaid on telemedicine, worked in the governor's office. Most importantly, I'm a nerd, huge nerd, giant nerd. Won computer programming contests in the 1980s. My mother still has the trophies. So I'm true to my roots, and health tech is my passion. And I'm very lucky to get to have the job that I have and do the work that I do. Tracy?
Yeah, thanks, Nora. And thank you, everybody, for joining this afternoon. And real quick on me, got 19 years experience in public education, public health, focusing on whole child, whole community. And I currently serve in a couple of different roles here in Texas, supporting children's health and mental health. I'm the presiding chair of the House Bill 906 Committee on School-Based Mental Health, that task force. A couple in my spare time, I volunteer on a couple local boards, and one of my favorite ones, of course, is being a board member of the Texas eHealth Alliance. As well as I'm a member of the HHSC Collaborative Task Force on Public School Mental Health. So thank you again for allowing us to share our experience coming out of this last legislative session and sharing some of the interesting events and outcomes from the session. So Nora, back to you.
All right, thank you, Tracy. Really quickly, because Tracy did mention her position as one of my board members, for which I am eternally grateful. Because she's fantastic. She knows how to be a board member. And if you work with a board of any kind, you know there are two kinds of board members, those that know how to be board members and those that don't. And that second group create a lot of work and don't always bring a lot of value. Tracy's really one of our valued subject matter experts, and I'm so happy that she's here with me today. We are a trade association, so just so you know, our mission is to be the state's leading advocate from local communities to the national level for the use of health information technology to improve the healthcare system for patients. Texas Tech system is a non-voting member, as are most of our public university systems here in Texas. We serve as the trade association for health information technology companies, and it's unlikely to come up in this setting, but I always have to do the antitrust disclaimer. If you don't like your vendor, I'm so sorry, but I can't speak to you about issues with your individual vendors. If you like your vendor, though, you can tell me that. I am not here as a representative of any individual interest. So let's get to the good stuff, the reason why you're really here. Let's talk about the legislature. In terms of the overview, I'm going to spend a minute or two sort of doing some higher level framing, talk about some of the bills we designated as important. I have a new feature this cycle for those of you who've seen me present before. We had what I dubbed some high risk bills this time in the telemedicine, telehealth space, bills that could have actually done more harm than good if they passed. And then I'm going to pass it on to Tracy, because her perspective on the mental health services is both global and specific to telemedicine and telehealth. And I think that'll complement this big picture that I'm going to paint. Another disclaimer, I would normally do charts. And if you've seen me present before, I'll put up lots of charts of bills. This was not a normal session. Nothing normal was happening this time. So I'm going a little deeper into some things than I would normally go, because it's important for you as stakeholders to know what the legislature is talking about, even if they weren't successful with that particular component. So here's our theme for today's presentation: the good, the bad, and the ugly, a classic spaghetti Western. I believe it's even in the Library of Congress, is culturally significant. But I'm not going to talk about the plot of this film, which I don't think I've seen since my dad made me sit through it as a child. I'm really just stealing the tagline "good, bad, and ugly" to frame up the legislative session. So let's set the scene. The good, as I'm sure many of you know if you read the newspapers, Texas has had this record budget surplus. There's general agreement on using it for school-related property tax relief. The bad. Each chamber has had a very different idea of what reforms would be best. The governor and the House are focused on cutting your local property tax related to school maintenance and operations. The Senate would prefer to see homestead exemptions be increased. They're not getting along. They don't like each other. It's on Twitter. It's personal. It's all inside the Republican Party. We also had 2 impeachment proceedings in the House and a summer full of special sessions. This second one started yesterday, and a partridge in a pear tree. So there is a lot of atmospheric stress, I would call it, between the chambers and between the leadership offices that's more intense and more personal than we've seen it in the past. And that did have some impact on the flow of the session. I always like charts and numbers. I only have one today, but I think it's important for you to see. Traditionally, the House generally files about twice as many bills as the Senate, but as you see them move through the process, you'll see the number of bills sent to the governor, the gap is not as small as the number of filed bills. So the Senate was really keeping a tight grip and making a lot of trades in terms of moving House bills on their side. But perhaps most interesting number to point out is that last number, the veto number. The governor axed a bunch of Senate bills because he's upset that they won't come his direction on property taxes. Some he vetoed for substantive reasons, and several he vetoed. And he said, well, yeah, this is important and not as important as property tax relief. So once I get property tax relief, I'm willing to reconsider this. That's very unusual. We do not normally see that sort of behavior from a governor, but Governor Abbott is very dug in. He's being very public. He's being very clear. Lieutenant Governor Patrick is also very dug in, being very public, being very clear. And so this continues. So in the middle of all this, we really wanted to have a good session for digital health, right? Have a good session for telemedicine and telehealth. And y'all may remember that last session we did House Bill 4, which Representative Price, who you all know really well, we thought that was hilarious. We would walk around and say, okay, vote for 4. We were the speaker's priority bill. We made a bunch of the telemedicine flexibilities permanent. Big success. Several other bills passed as well. Going into the session, I expected it to be a lower key, but I also thought we might be playing some defense. Because if in 2021 you thought telemedicine had scored a big victory and we were done working hard, that was a mistake. Now, as we're coming off of COVID and program integrity is being looked at, and there have been some very high profile federal investigations of some bad actors, we expected there to be some backlash, and there was. So let's start with the good off the top. The legislature set aside money in House Bill 9 to create an infrastructure fund. This is intended to act as match for federal grants and programs and things like that. I'm very excited about the continued work on broadband. This session also had a House Bill 4, but it was not about telemedicine and telehealth. The smaller numbers are selected by the speaker and the lieutenant governor. So the budget's always House Bill 1 and Senate Bill 1. The smaller your number, the higher priority you are in that chamber. So this session's House Bill 4 was a consumer data privacy bill by Representative Puglione, modeled on what's been done in Virginia. Healthcare is very clearly carved out, not just HIPAA, but research and other components. They did a great job with that. The only thing that I've told my folks they might need to worry about is if they have a storefront where they're selling T-shirts with their corporate logo to the public. That is a retail activity. And that would be covered by this legislation. But healthcare activities, we're feeling pretty good that we were clearly seen, clearly heard by the representative, and we were not included in that bill. But as a consumer, you need to be aware that you have new rights about your data. And the Attorney General will be enforcing that. So that's a good privacy development. Texas Tech came through, as always, with the renewal of the Next Generation 911 project through House Bill 617. I believe that also received some funding. So some of the folks on this call may know this better than I do. The idea here is to start treatment sooner in the ambulance before you get to the hospital. And I remember being in Lubbock speaking at this event, the TexLa Crossroads event a few years ago before COVID. And a young woman came up to me and said she'd lost a family member who could have had a TPO treatment to reverse their stroke, but they didn't get to the hospital in time. So she was very excited to see that our academic leaders like Texas Tech were taking this on. That was really cool. Cool moment. Love those. I got to have a cool moment because every once in a while, something I try to do does work. And that was working with two of the best legislators in the building, Representative Price and then Senator Charles Perry, West Texas representing, getting it done, talking about how we use home telemonitoring. So we've had a benefit for home telemonitoring in Texas Medicaid for a long time, but it's very restrictive. You had to have a couple of different conditions. You had to potentially have fallen down twice before you could qualify, no social structure. So we were really restrictive on who we would let into the program. Post-COVID, some of that looked way too restrictive. So we worked with the Medicaid program to revise the benefit, and we really made 3 significant changes. We added our federally qualified health centers and rural health clinics as participants. We simplified a lot of the eligibility criteria. So now you don't have to wait till you've fallen down. We will actually evaluate you for fall risk. And if you're at risk, that would help your eligibility for the program. Evaluating fall risk is a thing that healthcare knows how to do. So I feel really good about that component. We added a couple of new conditions, end-stage renal disease, and my personal favorite, high-risk pregnancy monitoring. As a mom who had a high-risk pregnancy, I am so excited at the idea that we'll be able to use technology to monitor blood pressure and other things for Medicaid moms while keeping them at home, keeping them healthy with improved outcomes both for the mom and for the baby. So this is a kind of a big deal for me personally, and I'm very excited about it. I also think there are lots of things we can do inside Medicaid with other populations that could be beneficial. So we moved the authority to expand the program from the legislature to the state agency. All of that being said, if this is something you care about, when we get to rulemaking, you'll be hearing from me because we have to continue to interact with HHSC and encourage them to grow this program. This one we worried would get vetoed because it came in late after the governor really started getting a little cranky about property tax situation failing, but it got signed. I was actually giving a speech about it when it got signed in Houston. So that was another kind of cool moment. So I'm about to start complaining. So I just want y'all to remember that I talked about cool moments before I got into my grumpy part of my presentation. So let's talk about the bad. This is not something, like I said up front, I normally do, but there's 3 pieces of legislation that I expect will be revisited in 2025. And I want to talk about these a little bit to plant some seeds of thought for those of you that work in this space, that believe in best practices, believe in compliance. The state is going to have to take this stuff on, and we're going to need to do better than we did this particular session. So I'm going to start with Senate Bill 2527. This bill did not pass, which is why I have its caption in red. But this was prompted by the very high profile failures of companies like Cerebral, which you can look up on Google. So I'm not telling you anything that's not in the public domain, who were using the pandemic waivers to prescribe controlled substances without an in-person visit. And I believe they are at least partially to blame for using up the nation's entire supply of Adderall. They were definitely not following good clinical guidelines. They were writing prescriptions to anyone who logged onto the platform. And the most high profile and tragic situation was a young man who had mental health issues, 15 years old, logged onto their platform, got Adderall, had it sent to his house, It didn't interact well with his other medications that he did not disclose. And unfortunately, he passed away. Senator Donna Campbell was very upset about this. She's still upset. And she really wanted to insert in-person requirements, parental participation, and some other things into our controlled substances prescribing to keep that from happening again. We ran into a couple of wrinkles, though, operationally. Number one is that the DEA is in the process of reviewing 32,000 comments on their proposed rules for in-person visits. So we don't know what the federal legislative landscape was going to look like. The second problem, of course, is the prevalence of the use of telemedicine in mental health treatment in the state of Texas for people with serious mental illness and others. We have huge swaths of the state that don't have psychiatrists physically available within driving distance for in-person visits. We just don't have them. So our federally qualified health centers, our local mental health authorities, other programs were very concerned that if you took a framework that said, okay, you can write the first 30-day prescription over telemedicine, but then they have to come in person. You're talking about a person with serious mental illness and other challenges. They didn't come in for that 30-day visit. You were supposed to terminate their prescription, which might not be the best clinical decision for somebody with a serious mental illness in terms of their overall health. So this was really a clash of program integrity, wanting to get the bad guys without cutting off Texans that really need virtual access to some of these medications. This will be back. So as a state, once we see what the DEA is doing, we're going to take a hard look at this and see are there other safeguards we need to put in place around parental consent, around prescribing. The senator was very disappointed. This was a high priority for her. So I fully expect it to be back, and hopefully we can work with her to land this in a place that doesn't cut off access to people in need while still holding accountable some of these bad actors. Similarly, Senate Bill 2064 by Senator Betancourt was looking at another high-profile federal investigation of companies that were scooping up patient data with questionnaires and tracking cookies and then selling it for third-party marketing without the person ever knowing that there was a sale of their data. Most of this is regulated federally. What Senator Betancourt wanted to do was hold Texas licensed providers also accountable by saying, if you're licensed in Texas and you work with one of these companies, they're selling data, there could be consequences for you at the medical board. Obviously, the physician groups didn't like that very much. They think the company should be held accountable, not the physician who might not recognize a clause in the contract, or maybe the contract got amended later. Is that really appropriate? There were lots of questions. There was lots of discussion. This bill didn't actually get out of the Senate. So it never had discussion in the House where I think we could have continued to work on it. There is an ongoing issue. The federal government's addressing it, but if you've met the Texas legislature, they don't think much of the federal government. So they were looking to craft their own solutions, both on online prescribing and then on sale of patient data that, of course, did not correlate with House Bill 4 because House Bill 4 had done health data carve-out. All these things interconnect. And all of these things are going to require us as stakeholders to continue to participate in dialogue about what the best practices are and what our posture should be as a state. So I look forward to partnering with the TRC and partnering with the experts at Texas Tech going forward on these. Finally, I had my personal victory earlier. Now I'm going to talk about my personal disappointment, and that was House Bill 1771. So I get asked a lot, like, what do you do when the legislature's not in town? You go to the spa, you work at 10, you go home at 2. Oh, no. They work, and they make me work. That's what I get for choosing this as a career. But they actually do something called interim charges and interim studies. So the House Speaker and Lieutenant Governor will say to the committees, I want you to do a deeper dive on this issue. I want you to take a hard look at, in this particular instance, how we document consent for virtual care. If you remember, during the pandemic, we were doing a lot of audio only. And my observation is not every organization did a great job with their consent documentation, because how do you really do that when you're speaking to someone on the telephone? So this was an interim charge. It was an interim study. The committee recommended that we look not only at ensuring that there were virtual options, but maybe even standardizing some of that across professions, so that teaching hospitals and academic health science centers could get some regulatory relief. It was great. We introduced the bill in the House, had a terrific hearing, passed it on the local calendar in the House. Everything was great. Take it over to the Senate. Again, we're working with Representative Price. Senator Zapparini originally agreed to pick it up. It gets posted for its hearing, and all of a sudden, Senator Kolkhorst is our Senate sponsor. And we thought, that's unusual. She's the committee chair. She doesn't normally do that. Wonder what that's about. We get to the hearing, and she had changed the caption of the bill to include rulemaking at the regulatory agencies. And she had added language to the bill to require, again, an in-person examination before an irreversible medical procedure is initiated. Now, what in the world is that? Where in the world did that come from? I can tell you, and she talked about this when she laid the bill out, so this is not supposition on my part. There is a huge fight over teledentistry in terms of whether an in-person visit with an X-ray should be required before you do clear aligners, who advertise on TV a lot, so I know you know who I'm talking about. There are two different models, one that requires an in-person visit and an X-ray, and one that does not. Both of them believe they are right. And they have been duking it out over this for several cycles now in the legislature. Senator Kolkhorst's father is a dentist. She has very strong opinions. She is in favor of the in-person examination. So she saw this as an opportunity to get that policy issue addressed. There was just one small problem. The House could not accept the broader caption change and the change to the substance of the bill because the House has rules, including something called the two-subject rule. The bill has to address the caption, nothing more, nothing less. The House rules were not going to allow, the parliamentarians were not going to allow the new caption and the new subject to come back to the House for what we call conference. So the House and the Senate meeting to kind of hash it out. So Representative Price called Senator Kolkhorst and said, this isn't going to work. We've got to take the bill back to where it went, where we started, the original purpose. And she was not interested in that. So the bill died. So it was 18 months of work on my part. And a very unusual set of circumstances. No, this is not normal. Normally captions don't get changed and things like this don't happen. There are rules that should just tell you how strongly Senator Kolkhorst feels about in-person examinations before clear aligners. So we will be refiling this next session and hopefully we'll be able to keep it clean because I do think it is important as a stakeholder community that we do get to some clear rules about documentation, particularly for audio only, and that we get to standardization. And no, it's not the highest profile. It's not going to be a House Bill 4, but it's important. And anyone who's ever worked on documentation for virtual health knows exactly why I'm saying that. So that was the bad. And I'm about to close my section out with the ugly. So you'll notice that every single one of those bills numbers is in red because none of these bills passed. These were bills that covered school services, insurance reforms like payment parity and private insurance regulated by Texas, a workers' compensation bill that I did have some concerns about because it mandated a telemedicine visit and wouldn't allow for in-person visits. And that's not great either, to be completely honest. None of these bills passed. And it was sort of a combination of some of them felt like vendor bills, some of them were too specific, some of them had fiscal notes, some of them there was, epic disagreement in the stakeholder communities, but that's a lot of bills to file and track to have not passed. So things not passing was a problem across the board. It wasn't like telemedicine and telehealth was getting punished. And I think that's important for us to hang on to because this looks like we suffered a lot of losses. Some of those bills were really not good, and I'm okay with them not passing. I'm a little more upset about the compacts. So if you're not familiar with licensure compacts, they allow participating states to recognize each other's licenses. The nursing compact is probably the one that's the best known. Texas participates in a compact for physicians, but it's more of an administrative compact. It doesn't grant you automatic pricing practice rights in other states. These bills went nowhere. The ones that got out of the House died in the Senate. The Senate bills didn't get heard because Chair Kolkhorst, who I was talking about a minute ago, does not believe in compact bills. She believes they are a surrender of state sovereignty in terms of regulation of health professions. She also believes there's hidden costs to the state and not a lot of benefit. And she believes in full Texas licensure. And she is the chair of the committee, so she has broad authority to set those agendas. I know that was disappointing for a number of the stakeholders, licensed practical counselors, dietitians, others that wanted to see this happen. But I think as long as she's our Senate chair, that's going to be an uphill battle. And of course, if you're doing multi-state practice, then that maybe pushes some cost to the practitioner to get states and multiple licenses in multiple states that could be simplified by something like a compact. But that was not what the senator had in mind, and those bills had no traction. So that's the ugly. It's pretty ugly. That's a lot of bills not making it across the finish line. But again, some of these were not great. Do not take this as a commentary on the legislature's lack of support for telemedicine and telehealth. I actually believe that support's very robust, but there are going to be boundaries drawn, as we see with the compacts and we see with some of these other bills. So good. We had some infrastructure stuff. We were able to make some changes for remote patient monitoring. Bad. There were some bills that didn't strike the right balance in terms of still letting our safety net providers and others provide care. And then, as I said, the ugly, these bills not going anywhere. I think we all need to kind of be okay with that. But as a slide, it looks pretty unattractive. And I have enjoyed texting this slide to people when they say, tell me again how many telemedicine bills passed. So 2. House Bill 617 and House Bill 2727. And here's the things that didn't go so well. So kind of a rocky session, but with some bright spots. And I won't try to sum up what Tracy's about to tell you because I like listening to her. I am just going to stop my sharing and see about passing her. Actually, I think I have to have it up to pass her the mic. I take that back.
I think you can share, Nora. I think I have shareability. Let's see here.
You tell.
Yes, I do.
You.
Okay, great. Everybody can see.
Yeah.
Let's see
Go,
if
Tracy.
Perfect. Everybody can see my screen. Thumbs up. Perfect. Thank you so much, Nora. Thank you so much. And certainly the good, the bad, the ugly continued on the children's mental health side as it relates to kind of global talking about school safety and increasing access, for children to much needed mental health services. We definitely going into this session, and as somebody who professionally and personally has spent a significant portion of my career inside of, working inside of public education and then now in the private sector, really advocating, for this increase in access and, better laws around, pay parity, access through, kind of what I would call these non-traditional access points, like through schools. And so certainly we had hope, coming into this session that, coming out of the pandemic and, experiencing the school massacre in Uvalde and, previous to that, Santa Fe, we heard state leaders, expressing concern about the rise in children's mental health. And we heard this not only from leaders at the state, but we heard it from, hospital systems. We heard it from school districts. We heard it from parents. We heard it, really nationally, state, locally. We're not immune to the impact that the pandemic and the increased rise in school shootings has happened, in schools. We're not immune to that. So we were really hopeful coming into this session, and unfortunately, legislators failed to provide, dedicated direct funding to school districts to help support student mental health. House Bill 30 did supplement. They did provide $2.2 billion to expand mental health hospital beds, build new hospitals, make other infrastructure investments and changes, but they didn't do much to direct, funding directly to school districts who then could, at the local level, make decisions, on what that would support. Can everyone still hear me? Yes.
You're a little echoey. There we go.
Can everyone
Now
still
you're
hear me?
back.
It's better.
Much better now. Thank you.
Laura, can you hear me?
Yeah, you sound a lot better now.
No, hold on one second.
Are you muted?
No.
It connected to my AirPods that are sitting in my purse. So, but I'm back. So thank you for that. It was trying to connect to my.
You thought you were gonna have issues.
I'm good. We made it through, y'all. We're okay. So what it did do, again, it funded some mental health services, through the LMHAs. And again, that's amazing. The local mental health authorities serve a vital and necessary role. Unfortunately, y'all, Texas is big. It's a big state. Speaking of school districts in particular, there are over 1,250 public-private charter schools in Texas. And a lot of that is rural. And so a lot of rural communities, family schools, they don't have good access to the LMHAs. And when they do, there could be a 30, 60, 90-day wait, even to get in for a mental health evaluation, a screening. Another bill that did pass, Senate Bill 26, it created an innovation grant program with the goal to expand access to mental health services, statewide, providing 15 million of funding really to and through the LMHAs to expand this outreach. MCOT, the Mobile Crisis Outreach Teams, those saw an increase in funding from 8 to 14 million. Again, when I talk to school districts during my day job, I hear a lot from them of the two biggest things is they are concerned about not knowing, who the students are, sitting in classrooms, coming to school every day. Who are the ones who are what we would call these silent sufferers, who are struggling? Unlike other physical health conditions, mental health is not something that when a child walks through the door of the school building every day that you can go, that child has undiagnosed depression. You can't see when they're suffering. And so oftentimes what happens is those undiagnosed behaviors over a period of time can manifest into a mental health crisis situation. And that's where many school districts and systems rely upon MCOT. Again, unfortunately, though, those mobile crisis outreach teams are not located, strategically across all areas where they're accessible when they're needed. TChat did get an increase in funding from $50 to $142 million, again, with the goal to extend services to more districts in Texas who choose to opt into TChat. So again, TChat, if you want more information about TChat, that was passed during the last session under Senate Bill 11. TChat, along with the other sort of this Texas Mental Health Care Consortium, added several different provisions to really increase and expand the access to mental health services. TChat is just a component of that Senate Bill 11 during the last session, in partnership with 12 university hospital systems, networked across the great state of Texas. But in 2022, when we look at the $50 million of funding that was provided to TChat, only 0.3% of the students were served on campuses. And when we look at the data, in 2021, according to the most recent YRBS, 33% of students reported feeling stressed, anxious, and depressed. And we see this number of suicide ideation, continuing to increase. So again, TChat is amazing and wonderful. And I talk to school districts all day, every day who are using and accessing, TChat, these services. However, they're not everywhere and they can't be, right? And so again, it's a great opportunity for school districts who choose to accept the offer from TChat to increase in this access to services for their students. But again, it's an offer. It's not a mandate. School districts do not have to partner, with TChat. Some things that were disappointing. Nora mentioned, her level of disappointment in some things that didn't happen. And I share in that disappointment, again, personally, professionally. House Bill 906 during the last session, or 2 sessions ago, actually, it created this school-based task force on mental health, and the role of that task force, which I also serve as the presiding chair of that, was to look at, how and when this funding is allocated to school districts to support school-based mental health. How are they using that funding? How are they using these partnerships? One of the report in our year 3 report that we presented in January to the legislators ahead of their session that says, hey, we've collected a bunch of data over this interim time period from school districts all over Texas, and we had about a 30% response rate from the 1,250 districts in Texas that said, hey, this is how we're using this funding. This is what we're doing with this money. And from this data and this information, we created recommendations and submitted them to the legislator. And one of those was the creation of this student mental health allotment to provide some direct per pupil allocation. Texas can learn a lot from Florida. Florida does this, Georgia does this, several other states provide a per pupil or per student allocation where districts have this money, have this funding available that they can then go make those local decisions on how to increase access to care, whether that's hiring additional school counselors to help with those low-level services, those tier 1 services, what we would call, or, partnering with, LCSWs or LPCs, bringing those to help, again, address those clinical, undiagnosed, untreated mental health conditions. It also did not pass bills that would expand the district's opportunity and ability to bill Medicaid for students who are receiving Medicaid services, to bill for those mental health services under the Medicaid and SHARS reimbursement program. I don't know if you're aware of this, but school districts do this now for students who are identified as having a 504 or an IEP. Traditionally, students who are receiving special education services, districts are able to bill through Medicaid and SHARS to receive reimbursement for these services. And in many districts, and in my former district that I was in, that could be, $20+ million a year that they would be able to receive from this Medicaid SHARS reimbursement to go back into the general fund to then go help globally, more of the students, within a school district. That bill, unfortunately, did not pass. One thing that they did increase, and I'm a little ambivalent about the increase, and again, this is Tracy personally, not the opinion of my employer or any of the boards that I serve on. House Bill 3 did marginally increase the school safety allotment. Now, this is an allotment that districts receive, and they can do a number of things with these. And in the bill specifically, it speaks to that this increase enables districts to hire armed guardians, making the allotment for them to focus on direct clinical, mental health, multi-tiered systems of support, tier 1, tier 2, and tier 3. It makes it unlikely that a district is going to, again, focus on what I would call the softer things while shifting their focus to more of the hardening of schools. So it will be very, very interesting to see how districts utilize this marginal increase in this school safety allotment to see if they're going to use that funding to hire armed guardians in school districts and on campuses. And I will say, from the previous sessions into this last one, I felt like there was a pretty significant shift. Again, they talked about the concern about student mental health. They talked about the concern about the safety of our campuses. And we shifted away from really having a more broad, in-depth, strategic conversation around how do we really, really get at improving children's mental health, reducing this access, reducing visits to the emergency room, for just basic mental health care, because oftentimes parents don't know what to do. School districts don't know what to do, right? They're sending kids away and hopefully somebody will pick up that child, wrap around them and say, we got you. And oftentimes when they're getting to the emergency room, they're overburdened, they're at capacity. They can't send them to community because they're at capacity. LMHAs are doing the Lord's work, but they're at capacity. And parents are left with going, what do I do? Right. So I definitely saw this shift going more toward the hardening, of schools and that conversation. So which leads kind of into the ugly part. We also didn't see additional funding to increase the reimbursement rates to the yes waiver, which we were hoping that would happen. That would help serve more students or more children who are presenting with these complex mental health needs. And if you're not familiar with the Yes Waiver program, it's amazing. I included a hyperlink in the PowerPoint to you can learn more about it. Other things that we were really hoping to see but didn't happen. There were not bills that were passed to ensure, students or children who have Medicaid would be able to access some additional services funded or covered under Medicaid, such as, treatment for, complex mental health conditions, functional family therapy. Again, we saw them not pass the bill that would allow school districts to reimburse for or get reimbursement for school-based mental health services. So disappointing. I think there's definitely need to be a significant amount of work, hopefully during the interim session, around looking at Medicaid funding, the Medicaid reimbursement rates, for children's mental health, absolutely 100%. A couple bills that did pass. So this is sort of the good part of the presentation. House Bill 1211 extended eligibility for loan repayment programs. I'm not going to go through the details of all of these bills. House Bill 2059, again, as Nora mentioned, our friend Representative Price, he did add a requirement or the option for first responders, military members, veterans to participate in youth mental health first aid training, which youth mental health first aid training has been a curricula. It has been training that's been provided to school districts for a number of years. It was required a couple of years ago, then they rolled back that requirement, and now it seems like it's back once again. Again, this is what I would call very early kind of tier 1 training on what does mental health look like in children, and what should you do when you have a child who you think might be struggling with mental health. So this is very sort of lower level layperson's training related to mental health. We see a couple bills that did pass. House Bill 2100, developing quality incentive payment programs for LMHPs. And then Senator West bill, Senate Bill 532, it reduces the requirement for mental health professionals from a 5-year to 3 years. Again, this is an interesting bill. Senate Bill 798 from Middleton, it eliminated the requirement that a school counselor currently, or they had to have 2 years of teaching experience before becoming a school counselor. So this bill eliminates that requirement. Again, should be very, very interesting. If any of you have had any experience working inside of education, it's a very different world than the private sector. If you're a professional who has had, such as a LPC, working in private practice, and you want to help and you want to work inside of a school system, it's a very different world. EDU is a very different beast. Again, I've been fortunate to work inside of EDU for my entire career, and it's very different. And if it was easy, everybody would do it. And it's not easy. So this should be very, very interesting, because I often said it takes a very, very special person to work with children and school-age children inside of an education setting. So I'll be very interested to see how this will impact, and if we will see again, I believe this bill, the intent of this is to really help with that workforce issue that we're seeing not only on the healthcare side, but also on the mental health side, is we're trying to increase the number of professionals that are entering the workforce to work, either in the private or the public sector to help support mental health. A couple other ones, Senate Bill 850, it adds Education Service Center representatives to that Texas Mental Health Care Consortium that I spoke to again previously under Senate Bill 11. And this is great. This is a great addition. I'm really excited about this because if you know anything about how school districts function in Texas, they're all ISD. That I in ISD is significant because it means independent, and they take that very, very seriously. So independent school districts in Texas, meaning they have local control, but there are 20 ESCs in Texas, divided geographically across the state, that school districts, they rely upon those ESC regions to help really support them and to provide them with some direction. Again, so having that voice from that ESC speaking, at the consortium, to the consortium, working collaboratively with them, really saying, hey, this is what I'm seeing and hearing on the ground from my area in Texas consortium, it'll really help to, I think, increase that understanding across Texas of what they're seeing and hearing at the local level. Again, a couple additional ones, Senate Bill 1727 from Schwartner. Again, it continues the work of the Texas Juvenile Justice Department for 2 more years. And then Representative Burrows requires district employees to have mental health first aid training. And again, it pushes those armed guards to us to address, safety concerns. Unfortunately, as Nora also shared with us, there were too many bills that did not pass related to children's mental health. And instead of listing the pages and pages of them, I'm pointing you to a resource that I really love. Texas Care for Children is a great organization. I have several colleagues who work for this organization, and I really love their post-legislative report, that they do a really, really nice job. And instead of me recreating their wheel or stealing their work, I'm sending you to a really great resource that already exists. But there were many. A couple ones that I was really hoping that would get a little bit more kind of legs or conversation. One of them was specifically related to school-based telehealth. And that was a bill that was filed by Representative Guerra. That was House Bill 1060. So that never made it out of committee, unfortunately. And that would have really helped to increase the access point of telehealth in schools. And, when we look at the history of telehealth in schools, the last time a telehealth bill specifically for schools was passed originally was in 2015. And then in 2017, under Senate Bill 922, that really opened the door for telehealth providers like the organization, like the company that I work for, to partner with school districts as that access point to increase care, across Texas, not limited by any geographical region. Again, a couple of the other ones that, again, I'm just going to say they did not pass. I'm hoping to have more conversation with the legislators in the interim session, specifically around, the Medicaid reimbursement for children's mental health care. And then one that I, had some hope for was House Bill 1157, which would have excused an absence from school for a mental health appointment. So right now that's an unexcused absence. But very interesting, there is a law around compulsory attendance that if a child through telehealth or through teletherapy, if they have a partnership with a telehealth provider, they can receive that unexcused absence if that appointment is facilitated through a tele-platform. And I love talking to school districts about that, because for school districts, that means funding for them. So anytime a child has to go home before that snapshot attendance time, that's a $45 per kid per day reduction from that district's average daily attendance funding that they would get. And so I love to talk to school districts about that says, understood. However, if you had a telehealth partner and the child received their teletherapy appointment while at school, you could use a OMD code to allow you to continue to capture that $45 for that kiddo so that you don't lose that funding. So again, it was good, bad, and ugly. And like Nora, I'm hoping during the interim session to have some more sit down, kind of meat on the bone conversations about the true importance behind, a lot of these bills that never made it out of committee to really, really, truly help make an impact on not only school safety, but let's start putting some real effort. Again, I think the things that did pass, like increasing TChat, attempt to increasing workforce, those types of things, I think they're great. Again, I never want to discourage the work in children's mental health, but I think there is much, much more work to be done, especially around telehealth and public-private partnerships to really help increase access to care on the physical health side and the mental health side. So thank you so much for this opportunity, and I will turn it back over to Nora and myself. We can answer any questions, and then we can leave a little bit more time for Laura at the end. So happy to entertain any questions that you might have.
Yes, we are handing out our contact information, so you can feel free to reach out to either one of us as a follow-up also.
All right, thank you all so much for that. If you have any questions, please feel free to unmute yourself and chime in, or if you're more comfortable typing in the chat, we'd be happy to present them on your behalf.
Hi, Nora. And
Hi.
hi, great to see you, Nora and Tracy, giving an excellent presentation on the summary of the complicated Texas legislative agenda, especially on topic of telemedicine, digital health, and children's mental health, and also hoping for more collaboration with you now, especially now we have a new executive director. You probably met him already during our visit in Capitol, Dr. John Cachago, our new executive director of our newly minted Institute of Telehealth and Digital Innovation. I am very personally ecstatic on the enactment, pardon the inaccuracy of or lack thereof of my legal lingo, but the HB 2727, the HB 617, and the Senate Bill 1146. Seems like a lot of great bill was passed, but I share with you some of this disappointment that some of the bill did not pass as well. My question for both of you, and you don't need to have the same answer, is if you have a magic wand and you want the bill to get away, to get into the legislature again and revisit it, what are those bill you think are the priorities that should be revisited again? Let's start with Nora, then Tracy.
Well, I will tell you that if we don't revisit House Bill 1771 to standardize that consent documentation and that paperwork, I am very concerned that we delivered a lot of services during COVID without appropriate documentation. I'm very concerned. So having their licensing boards, they've got the authority to do it without legislation. I'm going to encourage them to do it without legislation. But if you think about wanting to integrate digital platforms like Texas Tech, like Dr. Ray Spearman's vision, right? For Texas Tech, if every single health profession has a slightly different way of doing it, we're all going to really be under a lot of stress. And that's the kind of atmosphere where mistakes are made. So it's not the sexiest thing, but also it was a collective project with a lot of people involved, and it didn't pass for reasons that had nothing to do with things not being supported. But I think that that's important. And before I forget and let Tracy talk, when we get to implementation at HHSC for House Bill 2727, I'm going to need Texas Tech, because I am very concerned that the agency, bless their hearts, as we say in the South, may try to impose some limits on what we can do through rulemaking. And if we don't show up in numbers and say, no, we have evidence-based stuff, we know this works, we won't get the full promise of the legislation. So you and I can talk about that in the fall when we get to rulemaking. And I want to hand it over to Tracy, because I'm interested which of her children she picked as her favorite.
My favorite child would be, I hope we go back to have the conversation around Senate Bill 948, and that is that creation of the mental health allotment. I really, truly, again, I talk to school districts all day, every day, and what I hear that theme over and over and over again, because a focus on student health, student mental health, that is not a requirement, in education. And we all know what is required receives the focus, and they have to, right? They're an education institution. That is their role, to graduate kiddos college, career, life ready. But we also know, and I'm speaking to the choir when I say this, there are things that impact a student's ability to learn well, attend school, stay out of trouble, decrease those risk-taking behaviors. I've seen it, I've researched it, I've studied it, I've published it, I've talked about it, I'm blue in the face of talking about it. But until we are truly with our intentions of how we're funding the work, again, it's going to fall to the bottom of the very, very long list of priorities that school districts have to focus on, getting those kids across the stage. So I'm really hoping that we go back and revisit this very intentional, very strategic mental health allotment, where superintendents and nurses and school counselors aren't having to make these really hard decisions at the local level to say, okay, if I go fund a mental health program, or go fund a school counselor, or go fund an LPC, then I have to not fund something else, right? And so I'm really hoping, and thank you for the question. I'm really hoping that we go back to, reviewing Senate Bill 948, and also let's learn from our sister states, right? Florida, Georgia. There's a couple other states who have done this for a couple of years, who've done it well. So thank you for the question, and really hoping from my mouth to, the legislators' ears that we look at 948.
Thank you.
All right. Do we have any last minute questions? Otherwise, okay, if y'all will join me in thanking our speakers. This was wonderful. Thank you. It was really a pleasure to have both of you with us to enlighten us. It's complicated to keep track of everything that's going on, and y'all did a wonderful job of outlining everything that did or did not come out of this session. So we would like to present y'all both with our TexLa Challenge coin for all the wonderful work. And thank you again for coming onto our webinar presentation here. We really appreciate y'all and hope we have an opportunity to work together in the future. All right. And then just lastly, we have a spotlight on a couple upcoming events from the TexLa Telehealth Resource Center. Our next ECHO webinar presentation will be on July 13th with Dr. Aurora of the ECHO Institute. And we also have our annual Telehealth at the Crossroads Conference coming up at the end of July. That'll be an in-person event here in Lubbock this year on Thursday, July 27th. And I'll send an email link out to all the participants of today's event, as well as the slides from today's event, in case y'all have any questions or want to review those. All right. Thanks everyone for joining us. It was a pleasure, and we hope to see you next time.